In Madison, Dameron, combined with the other 6 hospitals in San Joaquin County, standing now at 123% of ICU capacity. Dameron itself at 133% of ICU capacity, the most of any hospital in San Joaquin County. Now, today, nurses across the state are claiming unsafe staffing standards will lead to more death and suffering. On a Zoom news conference call, nurses like Rochelle Herrig, working at Rideout Hospital in Marysville, speaking out about higher nurse-to-patient ratios amid perhaps the most dangerous time yet in the COVID-19 pandemic.
It's not the time to be decreasing the nurses that are available to help these patients. The higher ratio doesn't help the patients. Instead, this policy focuses on the unsafe ways for the hospital to make a buck.
Last week, Governor Newsom's administration began granting nurse-to-patient waivers to hospitals that include ICUs. If granted, hospitals getting the waiver green light can treat 3 patients per nurse versus 2.
That is why California nurses are adamantly opposed to handing the California hospital industry a gift that will surely increase the number of infections and increase the number of deaths.
In the aggregate, staffing is our #1 challenge.
So far, more than 59,000 healthcare workers in California have been infected with COVID-19. 228 have died. In response to the nurses' pointed comments, the California Hospital Association issued a statement saying the accusations are, quote, false and irresponsible. The CHA stating, quote, there is a serious shortage of critical care nurses and that the current crisis is 3 times larger than COVID-19's earlier surge this past summer. It adds the state has granted, quote, a temporary variance from nurse staffing levels only in units with COVID-19 patients. And there is a bit of good news regarding nursing levels tonight. Lodi Memorial Hospital adding 10 more ICU nurses from the state. We're live in Stockton. Back to you, Madison.
That is good to hear, Kurt, that some help is on the way. Appreciate the live report.